Good morning. I hope to see you all at 11 a.m. today in Apollo 24/7's Health Hour. Apollo's expert dermatologist, Dr. Radha Shah, is going to join us and give us essential hair care and skin care daily regimen tips. So join us and ask all your questions in the live session. See you there, 11 a.m. sharp. Good morning. I hope to see you all at 11 a.m. today in Apollo 24/7's Health Hour. Apollo's expert dermatologist, Dr. Radha Shah, is going to join us and give us essential hair care and skin care daily regimen tips. So join us and ask all your questions in the live session. See you there, 11 a.m. sharp. Good morning. I hope to see you all at 11 a.m. today in Apollo 24/7's Health Hour. Apollo's expert dermatologist, Dr. Radha Shah, is going to join us and give us essential hair care and skin care daily regimen tips. So join us and ask all your questions in the live session. See you there, 11 a.m. sharp.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour. This is a show which is giving us more power, which is connecting all of us with Apollo's expertise. Information is shared and awareness is being spread. So I welcome you to the show where today's show is going to deal with skin care and hair care. We have an expert dermatologist who's going to join us in a while. Dr. Radha Shah will be answering all your questions and queries in the live show. Yes. Let me also appear on the screen. Namaste once again, all of you. This is Jhansi here. Sorry for that technical glitch. And this show is designed to give you awareness and give you information. Today's show, we are going to talk about skincare and hair care, which is a major concern. Dr. Radha Shah will be joining us in a while. And today's show, we will also have health quiz where you will be able to answer 3 questions, which I'm going to ask, and you can win prizes as well. Stay with us till the end where we give out discount coupons and gift vouchers as well. So let's start the show today by talking about transforming health. Apollo has been the pioneer, the visionary chairperson of Apollo Hospitals, Dr. Pratap Chandra Reddy, has envisioned to change India's healthcare system, and he has transformed it by using technological innovation and bringing all the healthcare systems accessible to everybody in India. And the pillar of this patient-centric ecosystem is technology. In the recent times that we've all understood that our patients' need or the requirement of accessing doctors or healthcare systems has changed in many terms, in time, in currency, everything has changed. So understanding that we are pressed for time and we require, the pandemic also has put us in a space where we can't reach out physically, Apollo is transforming health again. 36 years earlier, they have transformed India's healthcare system in one way, and now they're bringing the entire end-to-end omni-channel Apollo's healthcare system, which is doctors, clinics, hospitals, diagnostic centers, and pharmacies, all of them together with the power of just one click. That is Apollo 24/7, an app which is going to connect you to a doctor just in 15 minutes, wherever, whichever part of India you are, and express medicine deliveries just in 2 hours, wherever you are in India. So it is going to be a boon. Just be there with us, download Apollo 24/7 and be a part of this technological revolution, transform health. Apollo Hyderabad had witnessed the Transform Health event last week, and a lot of you have joined the live show, where I also had been there as a part of this show. It is a privilege, and I'm very happy that I am also a proud member of Apollo 24/7's circle as well. Let me tell you, today is a special Sunday because all the circle members, which is a special membership plan for Apollo 24/7 users. If you're not a circle member, I urge you all to enroll in the Apollo Circle membership program, because special Sundays तो आते ही रहेंगे और बहुत सारे special benefits भी आप use करते रहोगे. Today is a special Sunday because on Apollo Circle membership, you get a consultation of Apollo doctor in just ₹49 all day long. You can consult a doctor for rupees 49 only. This is especially for Apollo Circle members. अगर आप already member नहीं है तो अभी enroll कर दीजिए. So let's dive into our questions. Our skincare and hair care, which is bothering us all the time. So I expect you all to interact well. I'm going to invite our expert dermatologist, Dr. Radha Shah, is going to join us on the show. MBBS, MD, Skin and VD, DDV, FCPS. She's a senior consultant dermatologist at Apollo Hospitals, Jubilee Hills, Hyderabad. She has more than 20 years of experience. She has authored many books on dermatosurgery and cosmetology. She is presented and awarded at various national and international conferences. She is very actively involved in clinical research. So it's our privilege and honor to have Dr. Radha Shah on the show. Namaste, ma'am. Welcome to the show.
Namaste, Jhansi, and thank you for inviting me to this show.
Great, ma'am. Ma'am, it's always a battle. It's always it's not just beauty, but I think it's also health, which is connected to skin and hair. So पहले ना लोग health is not something else for them. They want to look good. So skin issues तो सबसे priority होते हैं. How do we understand our skin health? Not as a cosmetic health, but how do we understand what is priority for skin and what are the types of skin?
So skin is as they say, it reflects your entire body. If you have a glowing skin, you know you're perfect inside. But yes, we have to learn to take care of our skin. And skin care depend करेगा आपका skin types क्या है. तो हम लोग basically 4 types of skin बोलते हैं. A normal skin जो बहुत ideal skin रहती है, ना ज़्यादा oily ना ज़्यादा dry, लेकिन बहुत कम लोगों को ऐसी skin रहती है.
Okay.
Most of them will either have an oily skin या फिर ड्राई स्किन और अ कॉम्बिनेशन स्किन. ड्राई स्किन जैसे नाम है तो स्किन ड्राई ही रहेगी ऑल द टाइम. इट नीड्स मॉइस्चराइजर, नहीं तो फटी फटी सी दिखेगी, स्केली दिखेगी, खुजली आएगी, दोस काइंड ऑफ थिंग्स. ऑयली स्किन है तो स्किन में बहुत चिकनापन दिखेगा, स्पेशली फेस एरियाज, और पिंपल्स होंगे, ब्रेकआउट्स होंगे, डैंड्रफ रहेगी. तो दैट इज एन ऑयली स्किन. मोस्ट कॉमनली स्पेशली जो यंग एज ग्रुप है, जो हमारा सबसे एक्टिव एज ग्रुप रहता है, दे विल हैव कॉम्बिनेशन स्किन, जहां पे सेंटर ऑफ द फेस एंड ऑन द फोरहेड यू हैव अ ऑयली स्किन, क्योंकि वहां पे ग्लैंड ज्यादा रहते हैं. और जो चीक्स हैं, जो हम कहते हैं वी जोन, टी जोन एंड वी जोन, द वी जोन विल बी द ड्राई स्किन. सो मोस्ट ऑफ देम हैव दैट स्किन. और हम लोग एक चीज और आइडेंटिफाई करते हैं जिसको बोलते हैं सेंसिटिव स्किन. चाहे आपकी नॉर्मल है, ऑयली है, ड्राई है, कॉम्बिनेशन है, लेकिन इट इज सेंसिटिव. मतलब कुछ भी आपने लगाया, आप एकदम उसको रिएक्ट करेंगे. सो दिस इज अ न्यू सबसेट जो बहुत कॉमन आ रहा है ड्यू टू वेरियस रीजंस. तो वो एक एडिशनल पॉइंट रह जाता है, बट बेसिकली ये स्किन टाइप्स रहते हैं.
Yes, I understand that anybody from any skin zone have to eat good food is what I understand to have good health, good skin health, I mean to say. So what are the common issues that we see in skin health?
कॉमन इश्यूज जो हम लोग देखते हैं यही रहता है, इधर अ वेरी ड्राई स्किन एंड देन एसोसिएटेड प्रॉब्लम्स लाइक एक्जिमास, एटोपिक डर्मेटाइटिस, या फिर ऑयली स्किन एंड देन एक्ने, पिंपल्स, उसके साथ ऑयली स्कैल्प, डैंड्रफ, हेयर फॉल, वो सब फिर एक एक प्रोग्रेस में रहते हैं. और अदर स्पेसिफिक स्किन डिजीजेस भी रहती है, जैसे कि सोरियासिस, लाइकन प्लेनस, एलोपेशिया एरिएटा. फिर वो स्किन डिजीजेस के एक इक्वल वॉल्यूम्स रहती है. So तरह तरह की है, पर कॉमनली ये प्रॉब्लम्स देखते हैं हम लोग.
Right. So is it connected to the way that we are living our lifestyle, our food choices? How do I take care of my skin?
या फूड चॉइसेस आर डेफिनेटली इम्पोर्टेंट, क्योंकि जो आप खा रहे हैं डिपेंडिंग ऑन योर स्किन टाइप, डिपेंडिंग आपको क्या स्किन या अदर हेल्थ इश्यूज हैं, जैसे आपको थायराइड है, पीसीओडी है, जो आज बहुत कॉमनली हम लोग देख रहे हैं, स्ट्रेस लेवल्स हैं, और आप खा नहीं रहे बराबर, इट विल डेफिनेटली अफेक्ट आपके स्किन पे कैसे वो प्रॉब्लम्स देता है. जैसे किसी को पीसीओडी है, ऑलरेडी ऑयली स्किन है, उस पे आप जंक फूड ज्यादा खा रहे हैं, फ्राइड फूड ज्यादा खा रहे हैं, लेट नाइट डिनर्स कर रहे हैं, दैट विल डायरेक्टली एग्रेवेट योर एक्ने. तो फर्स्ट थिंग विच हैज कम अभी स्किन में, पहले तो जब हम लोग स्टूडेंट्स थे, दैट इज ऑलमोस्ट 20 years ago, द थिंग वाज लाइफस्टाइल चेंजेस, खाली डायबिटीज और हाइपरटेंशन के लिए. लेकिन आज स्किन में भी हम लोग हर पेशेंट को लाइफस्टाइल चेंजेस बोलते हैं, विच इंक्लूड्स जो आप डाइट खा रहे हैं, रेगुलर एक्सरसाइज एंड यू नो अदर थिंग्स विच मॉडिफाई, क्योंकि वो डिजीज पैटर्न बहुत इफेक्ट होता है, पर वो अब जाके आया 20 साल बाद. सो वी आर एट पार विद ऑल द अदर डिपार्टमेंट्स ऑल्सो, के लाइफस्टाइल चेंजेस डेफिनेटली अफेक्ट स्किन.
तो स्किन केयर प्रोडक्ट्स में इन्वेस्ट जो करते हैं, एवरीबडी हैज वन और टू स्किन केयर प्रोडक्ट्स डेफिनेटली इन देयर वार्डरोब और कॉस्मेटिक रेंज. So will these help, and what are the skincare products that one can choose to buy other than the lifestyle modifications?
एवरी डे एक नया ब्रांड ऑर्गेनाइज लॉन्च होता है, एंड इवन वी इट्स डिफिकल्ट फॉर अस टू कीप अपडेट कि क्या प्रोडक्ट्स हैं. सो इट इज नॉट कि एक प्रोडक्ट अच्छा है कि बुरा है. नॉर्मली हम बोलते हैं यू स्टार्ट विद द बेसिक प्रोडक्ट्स जो आपके स्किन को जरूरत है. से क्लेंजर्स हैं, मॉइस्चराइजर्स हैं, सनस्क्रीन्स हैं, टोनर्स फॉर ऑयली स्किन है. सी दैट इट सूट्स योर स्किन. अभी तो हर जगह अगर आप अच्छे ब्रांड में जाओ, दे विल गिव यू अ टेस्ट एरिया. टेस्ट करके देखिए आपके स्किन को जम रहा है कि नहीं, देन पिक इट अप. सेकेंड इंपॉर्टेंट थिंग आई वुड ऑलवेज से लुक एट द कॉस्ट, क्योंकि जो भी आप स्किन का केयर कर रहे हो विल नीड अ लॉन्ग टर्म थिंग. इट इज नॉट कि आपने एंटीबायोटिक्स एक 1 वीक का खाया खत्म हो गया. यू आर गोइंग टू स्टिक टू इट फॉर लाइफ. So see that the product is affordable to you. Don't simply buy costly products and then after some time most of the people come and say I bought it, product बहुत अच्छा था लेकिन डॉक्टर साहब मैं इतना अफोर्ड नहीं कर सकता, वो महीने का जितना भी खर्चा होता है. तो लेट्स लुक एट प्रोडक्ट्स जो आपके पॉकेट में फिट होते हैं. Simple cheap products, Indian products, we also work equally well as imported products. But today's generation, people want to go, you have all relatives abroad, वो लाके मेरे को एक सैंपल दे के गया, मैंने उसे इस्तेमाल किया, बहुत अच्छा था.
Also, ma'am, it's also this mindset कि costly है तो अच्छा है.
Yeah, that is a big mindset. तो वो गलत है. I would not say that, क्योंकि आप थोड़ी देर के बाद उसको यूज नहीं करेंगे. Like again हम मॉइस्चराइजर देंगे, they will only use as long as they have the problem. 3 महीने के बाद नहीं, आपकी प्रिस्क्रिप्शन खत्म हो गई तो वो खत्म हो गया. वैसे नहीं, मॉइस्चराइजर तो आपको लगेगा लगेगा, यू हैव टू कंटिन्यू. तो कई बार हम बताते, कई बार स्किप हो जाता है. ऐसे नहीं कि हम लोग बताते नहीं है, बट सो बेसिक स्किन केयर हैज टू बी कंटिन्यू टू चूज प्रोडक्ट्स विच सूट यू and which you can afford in the long run. वो important
That's
है.
right. That's very important. And also choose natural products. जो इतना my personal question, ma'am, that there's so much of organic, certified, natural, herbal product. ये स्किन केयर रेंज में जो केमिकल फ्री होते हैं, are they seriously chemical free and will they help us?
तो एक तो वो डिपेंड करेगा कौन सा ब्रांड है. अगर वो ब्रांड्स आप रिलाई कर सकते हैं कि यस इफ दे आर क्लेमिंग इट इज केमिकल फ्री, इट मस्ट बी केमिकल फ्री. आई एम नॉट डाउटिंग दैट. लेकिन ऐसा नहीं है कि अगर एक प्रोडक्ट केमिकल फ्री है तो इट इज सेफ फॉर योर स्किन. So we have seen even with Ayurvedic products, with these home care products and natural, organic, तरह तरह के रोज जैसे मैंने कहा नए नाम आते रहते हैं, उन products के साथ भी reactions होती हैं. And so I will always say test patch करिए, देखिए आपको क्या जम रहा है. आजकल तो homemade therapies भी मिलते हैं, and then buy it in the long run. That is the thing.
मैम, would you advise all these home care therapies जे घर में बेसन यूज किया या फेस मास्क एंड फ्रूट पैक्स, जो घर के जो घरेलू नुस्खे होते हैं, all those home care tips, do you advise that will they help for skin?
See, home care remedies definitely work, पर यही है कि कोई कोई रिएक्ट करता है. अभी एक बहुत कॉमन जो इशू हम देखते हैं, इंटरनेट पे लिखा है गार्लिक यूज करो या हनी यूज करो पिंपल मार्क्स के लिए. वी हैव सीन स्पेशली गार्लिक के साथ तो लड़कियां क्या करती हैं, गार्लिक का पेस्ट रब करती हैं एंड दे कम विद अ बर्न. वो बर्न तो चला जाता है लेकिन उसका मार्क रह जाता है. सो इट इज नॉट कि द होम केयर इज रॉन्ग, बट it should be a proper product which area you're using it. honey, अब आपकी already oily skin है और आप उसे greasy products लगा रहे हैं तो it will go more oily. where will your acne end? तो वो चीज मॉनिटर करनी है. सो होम केयर रेमेडीज शुड बी यूज साइंटिफिकली. उनका प्रोडक्ट, उसमें कंपोजिशन क्या है, वो आपके स्किन को कैसे सूट कर रहा है. यूजुअली हम क्या बोलते हैं, अगर होम केयर कर रहे, आई जो मैं पर्सनली बोलती हूँ, शाम के टाइम लगाइए. क्योंकि सपोजिंग आपने से नींबू का रस मुंह पे लगाया है और आप धूप में निकले, मुंह नहीं धोया बराबर से, अब वो हल्का सा रस तो आपके स्किन पे है. अब वो और सनलाइट आपको रिएक्शन दे सकता है, क्योंकि लेमन जूस में एक प्रोडक्ट ऐसा केमिकल रहता है. तो अब आपको ध्यान नहीं रहा, आप सनस्क्रीन लगाना भूल गए या लगाते नहीं हैं, तो आप उस दिन गए और धूप से आए और आप ज्यादा डार्क दिखने लगे. तो मैंने तो कम लाइट करने के लिए किया लेकिन मैं और डार्क हो गया. तो वो चीजें, सो बेटर डू होम रेमेडीज टुवर्ड्स इवनिंग. होम रेमेडीज जब भी करें एट अ टाइम एक करें. कई क्या करते हैं, आज खीरा लगाया, कल टमाटर लगाया, फिर आलू लगाया. अब आप इतनी चीजें लगाएंगे, आपकी स्किन को क्या सूट करा नहीं किया कैसे पता करेंगे.
Exactly.
तो वन प्रोडक्ट एट अ टाइम, 1 week 10 days आपकी स्किन को जम रहा है, then you can try another product. That is
fantastic. Thank you for that tip, ma'am. And then the major concern for all of us is our hair, the crowning glory. तो हेयर फॉल एक बड़ा ही मार्केट भी बन चुका है, कंसर्न भी बन चुका है. व्हाट आर द रीजंस फॉर हेयर फॉल एंड हाउ कैन आई टेक केयर?
सी हेयर फॉल के रीजंस तो ए टू जेड रहेंगे, लेकिन कॉमनली जो रीजंस है, लेट मी टेल यू, मैक्सिमम इज अ बैड डाइट. मोस्ट ऑफ द पीपल डोंट ईट प्रॉपरली फॉर वॉट एवर द रीजंस, चाहे उन्होंने क्रैश डाइटिंग की, वेट रिडक्शन है, वर्किंग आवर्स वैसे हैं, दे आर स्टेइंग
Sleep.
सिंगल, हाँ स्टेइंग सिंगल, स्लीपिंग लेट. So for different reasons, they are not eating well. My first question to most of the patients who come across to me will be, what are you eating? Are you eating properly or not? क्योंकि वो skin पे आपको affect करेगा, hair पे affect करेगा. Second common cause is of bad diet is one thing. Second common cause is your PCOD. आजकल लड़कियों में PCOD issue बहुत है. We are getting a lot of hormonal issues. अब रहने को हमारे टाइम भी होगा, लेकिन our diet used to probably compensate to it. We were more physically active. आजकल की जो जनरेशन है, relatively physical activity is low. We have to tell everyone get up and move. As I said again, lifestyle changes. So that is another thing. And then of course there are things like thyroids, वाटर चेंज, पीपल ने रेजिडेंस चेंज किया तो वाटर डिफरेंट था, क्लाइमेट डिफरेंट था. मेनी टाइम्स चेंज इन शैम्पूज, आपने एक ब्रांड से दूसरे को बदला, चाहे रिप्यूटेड ब्रांड्स है, इट इज नॉट द ब्रांड इज रॉन्ग, वो आपके स्किन को नहीं जम रहा है. एज आई सेड अगेन, द होम केयर रेमेडीज, आपने सडनली कोई चीज लगाई, किसी ने आपको एडवाइस किया आप ये लगा लो, दही लगा लो, वो लगा लो, आजकल तो इतनी चीजें हैं आपका कि अंडा लगा लो, तो
मेथी लगाते हैं.
मेथी लगाते हैं, तो लॉट ऑफ थिंग्स आर देयर. अगेन किसी किसी को बहुत अच्छा जमता है, किसी को नहीं जमता है. सो होम रेमेडीज ऑल्सो आर अ बिग थिंग. फिर इम्पोर्टेड ये जो प्रोडक्ट्स आते हैं, हमारे सबके रिलेटिव्स जब आते हैं बाहर से, दे विल गिव अस ऑल दीज फ्री गिफ्ट्स, और वो हम लोग यूज करते हैं. एंड आई पर्सनली हैव आल्सो गॉन थ्रू फेजेस जब चीजें बिल्कुल नहीं जमी. आई हैव हैड clumps of hair coming out, so I know this product is not suiting me. तो
Yeah.
वो समझना पड़ता है.
But the pressure of looking good or pressure of having thicker, nice hair is always making us seek and reach out to multiple products. And market तो हमारे ये जो इस weakness है उसके ऊपर उभरते
Yeah, that is marketing.
products and products. So
That
how
is
do I take care? As you said, the common problems that I see, it's not just hair fall, it's also dandruff.
Yes.
So patchy itchiness, scaly
Yes.
dandruff से लेकर multiple kinds of dandruff. So how can I take care of these issues?
So dandruff के लिए तो you should basically use, see, basically twice a week तो shampoo होना चाहिए. There are people who will shampoo just once a week or once in 10 days. कई लोग soaps को used to है कि मतलब हम soap से सिर धोते हैं. That is okay. अगर आपको आदत है आप उसे stick कर सकते हैं, ऐसे नहीं है. Basically हमको सिर को clean करना है, तो आप soap करें, shampoo करें, doesn't make a difference. But at least twice a week. अब जिन लोगों की scalp oily है, especially in the active age group, students, you know, the young individuals, then they must shampoo thrice a week. You can do a regular shampoo or go for over the counter जो products आते हैं जिनमें anti dandruff claim करते हैं, if they're still not working, then there are medicated shampoos with ketoconazole and other products. It is not settling, consult a dermatologist. 247 is there every time, they can always call up. You don't have to come for a physical consult. You understand how to take care of your hair. Second is you have to work on the diet. Diet is very important. Basic milk, fruits, veggies, dry fruits, basic thing.
Yeah.
Try to eat on time. If you have other underlying diseases like PCOD, thyroid, see that they are under check.
Okay.
So those are the things. Usually I advise even once a week. If you oil your scalp, it is good because the oil massage is known to stimulate circulation, which will bring, oil massage once a week is always good. Any oil, again they'll say which oil. Don't invest in a costly oil. Simple coconut oil, वो भी बहुत अच्छा है. पर मेन है मसाजिंग एक्शन. जब आप मसाज करते हैं, यू हैव बेटर सर्कुलेशन. जब सर्कुलेशन बेटर, उसके साथ सारा ग्रोथ फैक्टर्स, न्यूट्रिएंट्स आते हैं. सो यू विल डेफिनेटली हैव गुड हेयर. एंड अगेन प्रोडक्ट्स आप चूज करिए जो आपके पॉकेट में है और जो आपके स्किन को सूट करते हैं. हर हफ्ते, हर महीने शैम्पू बदलना जरूरी नहीं है. मेनी पीपल विल से नहीं, हर टाइम शैम्पू चेंज करना चाहिए. इट इज नॉट रिक्वायर्ड.
Okay. So understand that it's not just an external product, but it is also your lifestyle and the nutrition that you have to take care of your skin and health. Ma'am, before I start the questions, there's one thing that I understood from your last answer कि Apollo 24/7 में जब आप consult करते हो skin and hair के लिए, anybody can reach out. These are not the simplest issues. Skin also has deeper issues. Say dermatitis से लेकर psoriasis तक बहुत सारे deep issues है. अपोलो 24/7 में रिमोट कंसल्टेशंस में स्किन एंड हेयर कैसे बेनिफिट हो सकते हैं?
See, I always feel जो skin है, my department, it has advantage through your IT thing, क्योंकि हम लोग खाली देख के भी most of the cases diagnose कर सकते हैं, products यूज करने एडवाइस कर सकते हैं, जो आप यूज कर रहे हैं वो सही है कि नहीं वो आपको गाइड कर सकते हैं. So many people have started coming also कि एक सेकेंड ओपिनियन लेते हैं कि जो हम यूज कर रहे हैं सही है कि नहीं है, क्योंकि डाउट्स रहते हैं. और अभी लोग मूव अराउंड करने से फिर भी थोड़ा डरते हैं, हॉस्पिटल्स आने में डरते हैं. तो आप घर बैठे बिठाए आराम से एक एडवाइस ले सकते हैं कि कैसे करना है, या जो आप प्रोडक्ट्स यूज कर रहे हैं सही है कि नहीं है. एंड अगर हम पिक्चर्स भेज दें और अपनी मेडिकल रिपोर्ट्स भेज दो, इट इज वेरी इजी टू ट्रीट अ पेशेंट ऑनलाइन. टुडे तो बहुत इजी हो गया, एंड 247 गिव्स यू अ गुड नेटवर्क एंड कनेक्टिविटी. So it should not be a problem, and availability of a wide range of doctors available.
Yes, and that's nice. And Dr. Radha Shah can be consulted on Apollo 24/7 if you have a issue that I cannot take up on this show, and if you still want to speak to her, you can consult her on Apollo 24/7. So, ma'am, I'll start with the questions. YouTube में बहुत सारे questions पूछ रहे हैं. The first question which has reached us is from Divya Sehgal, whose daughter is suffering from back acne and terrible scars from last 5 years. She is not hypothyroidic, but her hemoglobin is low, 7.6. She has major hair fall issues also. Please advise us.
Age बताइए इन्होंने?
नहीं बताया मैम.
Okay, fine, no problem.
Ms. Divya, if you can please text the age of your daughter, that will be helpful. I don't think she'll be able to respond so fast, ma'am. But
okay, no problem. So basically, back acne and hair fall hair. So this she must be having dandruff also, what we call seborrheic dermatitis. तो उसकी वजह से पीठ पे acne ज्यादा रहते हैं और hair fall भी रहती है. तो she must do a good shampoo which controls her dandruff at least twice a week. Ketoconazole based, या अगर वो use किए तो coal tar based है. She can get in touch with the doctors. And back acne के लिए again there are creams available. Which we can use, hydroquinone, tretinoin, many creams are there. वही होता है background history क्या है, and PCOD I think उन्होंने mention नहीं किया उसका PCOD है कि नहीं है,
जी.
है ना? Yeah.
No, it's not mentioned.
Yeah,
I'm
PCOD,
still searching if she's responded back करके, but
okay, no problem. PCOD भी उस पे.
Okay, she's an 18-year-old. Divya
18
Sehgal has responded. 18-year-old. And any PCOD, Divya ji, कुछ है तो आप type कीजिए please immediately.
Yeah. And anemia can be again one cause of hair fall. That's what hemoglobin 7 काफी low है. तो जब तक वो normal आएगा, she will need a lot of vitamin supplements, whether iron and the multivitamins. And again, look के कारण क्या इतना hemoglobin drop क्यों हुआ? तो dermatologist और physician दोनों उसको manage कर सकते हैं.
No PCOD, ma'am.
No PCOD. Good. Okay. तो hemoglobin को correct करेंगे तो definitely her hair fall should improve. बाकी ये कि dandruff को control करना है. फिर soaps on the back, like you know this you have soaps with acne के लिए इसके soaps रहते हैं, oily skin के लिए soaps रहते हैं. She can do those products. Creams at night, and if she's still not responding, then we have some good drugs like isotretinoin. वो भी शुरू कर, but then उसमें डॉक्टर की एडवाइस चाहिए. इट इज डिफिकल्ट कि मैं इस प्लेटफॉर्म पे पूरी प्रिस्क्रिप्शन आपको बोल दूं, बट शी कैन डेफिनेटली गेट इन टच. दे आर ऑल ट्रीटेबल. व्हाट्स इंपॉर्टेंट इज ऑल दिस इज ट्रीटेबल. स्टार्ट अर्ली ताकि आपको रिजल्ट्स जल्दी आए.
जी, exactly. Okay. Next question I want to take up is from Ms. Shubha Nair. Hair, kali mehendi, etc. have known to have affect the blood cells and cause scalp itching also. Would you suggest any natural remedies to cover the grays? Of course, hair colors and hair dyes have been.
There is no natural remedies. The only thing हम लोग बोलते हैं जिनको स्पेशली एलर्जीज रहती हैं हेयर डाइज को, देयर आर सम पीपल जो हेयर डाई टॉलरेट नहीं कर पाते, देन वी टेल देम जो मेहंदी की लीव्स हैं उनको ग्राइंड करके वेट करके पेस्ट बना के लगाइए, पर वो एंड में एक ऑरेंजिश शेड छोड़ेगा. अदरवाइज देयर इज नो नेचुरल रेमेडी फॉर हेयर ग्रेस. नो, यू हैव टू गो टू केमिकल्स ओनली. है कुछ प्रोडक्ट्स पर वो इतना अच्छे नहीं देते. देयर आर सम नेचुरल हेयर डाइज कुछ कंपनीज बना रहे हैं, पर उनका ब्लैकनेस वो उतनी नहीं आती है, एंड इट लास्ट फॉर लेस टाइम. सो यू कैन पिक अप दोस प्रोडक्ट्स.
Yes, or age gracefully like Radha ma'am, or great. So
I'm flaunting my grace.
Age gracefully. Yeah.
True.
Next question is from Manoj Agarwal. Any tips to half a tablet daily?
I think Allegra 120 is a very low dose. For hives, we need 180 once a day. And कभी hives रहते हैं कि they will persist for a long time, so you can continue to use it. But I hope कि आपने basic investigation, CBP, thyroid, total IG, वो टेस्ट कराए हुए हो कि वो नॉर्मल हैं. Then also hives can persist. लेकिन अगर उनमें कुछ इशू है, then that has to be sorted out. Otherwise, Allegra 180 is a better option. Allegra 120 is a pediatric dose. It will not
वो
work.
भी half tablet ले रहे थे.
वही तो कहनी 60 mg जा रहा है. It's a pediatric dose. It will not work. He needs a higher dose, and it's a safe medicine even if you use it say 1 साल 6 महीने. अब डिपेंड करता है आपका अर्टिकेरिया क्या लास्ट करता है, और अगर कॉज पिकअप कर सकते हैं तो उसको अवॉइड कर सकते हैं. That is the thing.
Exactly. That's important, no, ma'am, to understand what is causing it rather than just keeping it under side.
Yes, cause is important.
Yes. So, yes, cause is important, and ma'am can be consulted. Mr. Manoj, she can be. She's available on Apollo 247. You can further take her advice. Then next question is Bandi Manideep. To reduce dry skin, ma'am, suffering. What do you advise?
ड्राई स्किन ना,
कहाँ ड्राई स्किन है बताया नहीं है, बट ड्राई स्किन है उनका.
सी ड्राई स्किन मोस्टली तो टांगों और बाहों पे होता है, बट देयर आर सम पीपल हु विल हैव फुल बॉडी इंक्लूडिंग फेस. सो ड्राई स्किन है तो यू हैव टू यूज क्या बोलते हैं जो माइल्ड सोप्स रहती हैं, पियर्स हैं, डव हैं, और भी 1000 प्रोडक्ट्स हैं मार्केट में. यू कैन गो एंड पिक अप अ प्रोडक्ट फॉर ड्राई स्किन. आजकल मोस्ट प्रोडक्ट्स लेबल किए होते हैं कि वो ड्राई स्किन के लिए हैं कि नॉर्मल स्किन के लिए. सो दैट ऑल्सो शुड बी अ वे टू फाइंड आउट क्या प्रोडक्ट खरीदना. जस्ट डोंट पिक इट अप ऑफ द शेल्फ. और देन इज द यूज ऑफ मॉइस्चराइजर्स. अब अगर बहुत ड्राई स्किन है देन दे शुड डू मॉइस्चराइजर्स जो थोड़े ऑयली रहते हैं. तो एक मॉइस्चराइजर रहते हैं तो लाइट रहते हैं, जैसे जिसको एक्ने रहेगा हम कहेंगे लाइट मॉइस्चराइजर्स यूज करो. जिनको ड्राई स्किन है थिक मॉइस्चराइजर्स, so something like petroleum jelly, thick oils. Then you have a lot of medicated products and over the counter moisturize also, but वही देखना है लेबल रहना चाहिए for dry skin. And again एक ड्राई स्किन का प्रोडक्ट मुझे अच्छा सूट कर सकता है लेकिन आप पे वर्क नहीं करे, तो देन यू सी आप पे कौन सा ज्यादा देर वर्क करता है एंड स्टिक टू दैट प्रोडक्ट. जब भी लगाएं उसको थोड़ा वेट स्किन पे लगाएं, सून आफ्टर बाथ, जब स्किन थोड़ी गीली है, एकदम पोंछना नहीं है, तो वो करे तो मॉइस्चर को ज्यादा देर ट्रैप करता है. एंड अगेन मिल्क प्रोडक्ट्स, विटामिन ए, फ्लैक्स सीड्स, ऑल दीज थिंग्स विल बी हेल्पफुल फॉर ड्राई स्किन. यस.
So that is consumption, not to apply.
Consumption. नहीं सॉरी, कंजम्पशन
के लिए. Yes. मैं कहीं गलत समझ ले और कल से फ्लैक्सीड पूरा पाउडर बना के
ना इरिटेशन हो जाएगा.
इरिटेशन हो जाएगा. My next question is from Mr. Sushil Sharma. He's a 32-year-old male, severe dandruff issue from last 4 to 5 months, and now even eyebrows have dandruff. Every medicine and nothing's working on me. Please suggest any permanent solution.
See, permanent, ये तो बहुत लोग बोलते हैं डैंड्रफ के लिए गिव अस अ परमानेंट सोल्यूशन. लेट्स बी क्लियर, वर्ल्ड में डैंड्रफ का परमानेंट सोल्यूशन नहीं है. डैंड्रफ का अप्स डाउन्स रहेंगे. अभी उनका थोड़ा अप चल रहा है क्योंकि वो आंखों पे भी फैला हुआ है. एंड यूजुअली सीजन के हिसाब से, अभी जैसे ठंड चल रही है, ठंड के मौसम में डैंड्रफ विल बी मोर. आपका स्ट्रेस लेवल्स हाई हैं, इलनेसेस हैं, आप ट्रैवल करें हो कोल्ड क्लाइमेट में, ऑल दीज थिंग्स से डैंड्रफ गोज अप. And we can do shampoos and medicines to keep it under check, but no doctor can say do this और आज के बाद आपको dandruff नहीं होगा. तो अगेन आपको देखना है कि आपको क्या प्रोडक्ट्स जमते हैं. अगर आपने कीटोकोनाजोल बेस्ड प्रोडक्ट्स यूज करे हैं तो कोल्टार के भी शैम्पूज रहते हैं, वो कर सकते हैं, और सर्टेन लोशंस रहते हैं नाइट में लगाने के लिए. वेरी बैड केस है तो यू कैन देन इवन डू योर क्या बोलते हैं अपना एंटी फंगल टैबलेट्स या कैप्सूल्स दिए जाते हैं. तो वो केस देखना पड़ेगा क्या बैड है. एंड अंडरलाइंग थायराइड्स एंड शुगर्स, कॉमनली हमने देखा है जो पेशेंट्स रिस्पॉन्ड नहीं कर रहे होते उनका शुगर्स और थायराइड इश्यूज रहते हैं. तो 32 है, वी आर सीइंग कॉमनली. कितने पेशेंट्स का हम लोग सिर्फ पिकअप दे कीप सेइंग नहीं हमें नहीं है. इसे एक टेस्ट स्क्रीनिंग करो और चीज निकल आती है, देन वी से बी केयरफुल ऑन दैट.
Okay.
That's fine.
Our next question is from Prithvi. He says that his hands have become very dry. Each time he uses a soap, then he feels that there's a white layer which is residual after washing hands especially. So abhi to hand washing routine, we have all increased our hand washing, hand sanitizing routine. Most of us have due to continuous hand washing, we have dry hands. Even I face that issue.
Yes.
What would you suggest, ma'am?
मॉइस्चराइजर यू हैव टू यूज, जब जब हाथ धोए मॉइस्चर, जहां पे मॉइस्चराइजर रखा है साथ में एक स्प्रे रखो मॉइस्चराइजर का। तो हैंड वॉश किया, साथ में मॉइस्चराइजर किया। एंड नाइट के टाइम यू कैन यूज थिक प्रोडक्ट्स, जैसे कि अपना व्हाइट पेट्रोलियम जेली है, घी है। कई लोगों को स्मेल आती है बट घी इज अ वेरी गुड मॉइस्चराइजर। और सैनिटाइजर जितना हो सके उसको मिनिमम यूज करिए, जब जरूरत है तो करिए। कई लोग हैबिट है हर 5 मिनट पे सैनिटाइजर स्प्रे करेंगे, ओवर यूज से स्किन खराब होती है। कितने लोग हम सैनिटाइजर की एलर्जी से अभी देखे हैं इस दौरान में ही, जस्ट
Yes,
बाय
ma'am.
यूजिंग
But
सैनिटाइजर।
at times when there is no soap or water available, sanitizer does come handy.
हाँ,
But
यस, दैट्स
yes,
ऑल।
we
तो
have
जब
to.
जरूरत है करिए, लेकिन साथ में एक मॉइस्चराइजर भी कैरी करिए ना। तो सैनिटाइजर के 5 मिनट बाद आप मॉइस्चराइजर लगा लीजिए,
Yes,
और
that is
एटलीस्ट
an
नाइट,
important tip
या
madam is
वेरी
given.
इंपॉर्टेंट।
It's a very important tip, ma'am.
या
I'm
वेरी इंपॉर्टेंट।
not using that. I
या
anyway have a hand cream, but I don't use it as much
या
as it should be.
या
We should. I will make sure that I'm doing this.
ओके, गुड।
So much, ma'am. Ma'am, next question is from Vinod Kumar Reddy, who has issues of pimple. Pimples के बहुत issues है, but he has formed an entire structure on the nose due to pimples. I suppose he has a lot of pimples, so it has deformed kind of look. How can he address this issue?
ओके, तो अगेन डिपेंड करता है अभी आपके बाकी पिंपल्स कंट्रोल हैं कि नहीं। और अगर आप बोल रहे हैं कि नोज आपकी डिफॉर्म हो गई है या उस पे है, तो दो चीजें
Ma'am,
रह सकती।
he'll want an answer in English, ma'am.
ओके, सो
It
if
depends
you're
on
saying, yeah, it
the
depends
other
basically
pimples.
you're still having active acne or not. And the whatever you're saying, the swelling on the nose, that could be either they are pimple scars, or you have a condition called rosacea, because that can also present as bulbous swellings on the nose. So I think you need to meet a doctor and see, because then the treatment lines totally change, and if they're not going down, then you have lasers and other procedures to remove those swellings. So
Oh,
that may need a little, yeah, intervention it may need,
okay.
but
So it's
activity
not.
देखना पड़ेगा।
Yeah, it's not something where he can just ask a question and over the counter कुछ ले ले, tips ऐसे ले ले, ऐसा नहीं है. So he has to come consult physically and see
I
what.
would I would suggest that, because he's saying he has persistent swellings on the nose. So when
Yeah,
the
the structure,
swellings are there, yeah,
yeah, the structure itself has gone deformed. So
yeah. So we have to see whether it is the acne scars or whether it is your rosacea. Because one, then you need the active management that the disease quietens, and then we work on the scar, restructuring the nose shape, the skin, the thickening in the skin, basically that way.
sure, ma'am. All right. Next question is from Venki Gowda. He says, I have a lot of skin pores, open pores on the face. How can I reduce?
Yeah, open pores basically will come along with the oily skin. So use products on the face which are for oily skin. Don't use moisturizers for a normal skin. Use very light moisturizers. And if you have to use, if you don't feel dryness on the face, many times we say don't use a moisturizer. Cleanse your face, use a toner or astringent, and then you can add a sunscreen. Now sunscreen, if you use, then you have to see that you're using a product which is for, again, oily skin. क्योंकि आप कोई भी sunscreen खरीदोगे, many sunscreens are also very greasy, so they will make your skin oily. So that is one thing, choosing the products. And there are creams containing glycolic acid, tretinoin, which can be used at the night to tighten the pores, which work for few hours. उसके beyond, तो you have to consider procedures like chemical peels या skin lasers,
Okay.
micro needling, radio frequency. Yeah, so it depends कितने open pores हैं और कितना उनको response मिल रहा है with the creams.
And also, it has to be under a proper guidance and proper
Yes,
suggestion.
absolutely.
It cannot be taken as a call from such shows. So you better consult, ma'am, to
Yeah,
take it further.
yes.
Ma'am, next question is from Ibrahim. He says that he has dark spots around from 8 months on. He's not mentioned where the dark spots location is, but I have used a lot of medicine, but it does not work. Any solutions? I think that's a very
Vague question, because dark spots could be on the face, they could be around the eyes, they could be on the body. Again, there are a lot of creams available. Now, if it is on the sun exposed area, say your face, neck area, you must use a sunscreen, because many people don't use a sunscreen. Sunscreen also, it's important. What is the SPF? There's something called SPF, sun protection factor. Minimum, I would advise 30. If someone is in a lot of outdoor activity, then go to 50 to 70. Again, choose a product based on your skin type, whether it is a product for, for your oily skin
Oily
or
skin, dry
dry
skin.
skin. Frequency of application, you must apply it once after bath, and definitely if you're roaming around a lot in the afternoons, say swimming, trekking, those kind of events, every 2 hours also we say. And if someone is at home, just one application is enough. And
Okay.
along with that, then you can use these other creams to help the pigmentation to go down, creams containing hydroquinone or glycolic acid. So there are kojic acid, many products are there. You get creams with the multiple products combination. And if you're still not working out, then you have chemical peels to help you go down. Lasers are there which can help on. I still prefer peels over lasers for pigmentation, but yeah, वो हर पेशेंट
Yeah.
के केस पे है कि आपको क्या चीज जमेगी.
Right. Prem Kumar Lazar's question is coming next, ma'am. I am having hair fall for last 2 months. I'm taking neuropathy treatment for diabetic. Is the hair fall due to that?
नहीं, unlikely. It's
Unlikely. Diabetes and diabetic neuropathy is
diabetic neuropathy is involving the nerves. It will not affect your hair. Now, if you're having other issues, then say you have an associated thyroid, you're not eating well, especially on the fruits and veg, because fruits limit हो जाते हैं diabetes patient में. So आपके vegetables भी कम हैं, proteins are less, then it can affect. And if you're under stress, that can affect your hair fall. Or if you have a family history of male pattern baldness, से गंजापन जो रहता है फैमिली में रन करता है, then maybe it is getting starting because of your this thing. Neuropathy means diabetes must have been advanced to involve the nerves.
right.
That is
So
why.
that's a very different thing, and your hair fall is a different thing.
Yeah, not connected. Not connected.
Not connected.
Not at all.
No, he has to separate both the issues and then
Yes.
consult a dermatologist also, not just
Yes.
diabetic or
Yes.
medicine right now. Next question is from Murli Krishna Sunke. What are the latest and advanced treatments for severe plaque psoriasis?
Plaque psoriasis, yes. Biologics are the latest treatment. Baki, if he must be knowing about psoriasis, that's why he's asked me this question. We have a lot of biologics out in the market. Various are there. Some of them are giving very good instantaneous results like secukinumab, and you have apremilast. It so depends, but apremilast may not work when it is very active. Cyclosporin, of course, these are older drugs, so I won't call it advanced. And basically it's the biologics. Your biologics attacking at different levels of inflammation. So it depends now what you have received before. Then you can, even if you have received a biologic before, you can still take another biologic. We can combine biologics with cyclosporin or methotrexate or apremilast, and as you come under control, then we can switch to the milder therapies.
So psoriasis is again not a simple thing. It's going to be
Yeah.
a longer treatment and a longer management.
And individual based, depending on what are your involvement, areas of involvement, other problems that you have, what treatments you have taken, how they are worked out. That's why.
Yes, ma'am. Next question is from Shweta and also a lot of other people. Pankaj Kumar bhi yahi question पूछते हैं. They're asking about hair fall has increased and we have dandruff issues. What are the tips?
Yeah. Well, hair fall, dandruff basically interrelated, and use a good anti-dandruff shampoo. You can use those with ketoconazole. Another problem I have seen with ketoconazole shampoos, when we give, हमने medicated shampoo दिया, patient क्या करता है, उसको पानी में mix करके लगाता है. तो वो नहीं करना है. Please shampoo को shake करिए, pour it on your palm, apply it on your head, leave it for 2-3 minutes and wash. क्योंकि drug को 2-3 मिनट वर्क करने का टाइम देना चाहिए. अगर आप उसे पानी में मिक्स कर रहे हैं, डाइल्यूट कर रहे हैं, तो वो रिजल्ट नहीं है दिखेगा आपको. एंड फ्रीक्वेंस शुड बी एटलीस्ट ट्वाइस अ वीक. गीले बाल नहीं बांधिए. कई लोग गीले बाल, स्पेशली लेडीज, टाई द पोनी और समथिंग इमीडिएटली. गीले बाल में फिर डैंड्रफ आएगी. सो यू शुड लेट योर हेयर ड्राई नेचुरली, यूज अ हेयर ड्रायर. एंड वो किया, देन अगेन कम्स इज योर डाइट, because hair fall would be related to that. And if you
Yes.
have other problems like thyroids, PCODs, फिर उसको आप control करिए.
Yes, yes. Definitely other factors make a lot of impact on health. But जो हमारे हाथ में है, health issues and hormonal issues are not in our hands.
Yeah.
Diet and other have lifestyle factors तो हमारे हाथ में है ही.
Yeah, that is what we can control. So if we control that, hair fall eventually settles. वो settle
Yes.
हो जाता है.
Also in the times of pandemic, ma'am, we all have talked so much about immunity and increasing of supplementation. This is my personal question, it's not there.
Yeah,
But
no problem.
supplementation, everybody has started to use non-judiciously on their own. Do you think that this will help, or does over supplementation also have a bad effect on skin and hair?
See, over supplementation, not really, if it is only B complex, but vitamin D can give. Recently, abhi ek case tha, daily she came with severe hair fall, already gone to 3 dermatologists, and she says, my hair fall is not settling down. And then I looked at all her reports, all were normal. Vitamin D thoda low tha for almost say about 2 months back. Supplementation uski abhi bhi chal rahi thi. So I said, you don't have to do so much because excess vitamin D, excess vitamin A, क्योंकि ये फैट soluble vitamins होते हैं, body cannot throw them out, so they will get stored in the body. Extra of these vitamins can definitely aggravate hair fall. So B complex vitamin C is okay, क्योंकि आपने extra भी लिया, it will be thrown out in the urine, but not the other vitamins, and they can give you hair fall. So we do see that and say don't overuse the vitamins.
Thank you so much, ma'am. That's a very, very conscious call that one has to take कि कितना use कर रहे हो और on prescription ही use करो.
Yes.
Right. Next question. I think we have also talked about Sridhar Tumki. Aapka question also we have part of the discussion about hand wash and excessive use of sanitizer. We have covered it. Next question I go move on to is Manish Gupta's. Of late, I'm having rashes on hair, scalp, and forehead. Please suggest how to cure it. Rashes on scalp and forehead.
Yeah, mostly ये dandruff के ही rashes रहेंगे, जो हम seborrheic dermatitis, technically उसको seborrheic dermatitis बोलते हैं. तो जब dandruff spills over to the forehead and all, तो वो माथे पे, back of the neck, जो nape of the neck है, ऊपर की पीठ पे, it will give you rashes. So
Yes,
that can be there. So again, he has to work on the good anti-dandruff shampoos. And अगर कुछ और health issue है तो उसे control. Basically, the anti-dandruff shampoo. And there are varieties available. अगर एक चीज work नहीं कर रही तो किसी और चीज को हमको फिर coal tar base use करना होता है, या we add some lotions to be applied at night. तो वो तो patient to patient vary करेगा. That is important.
Yes, ma'am. Ma'am, we have another 10 minutes left, so I'll read the questions quickly so that we can answer more questions.
Okay.
इनका question है, बहुत dry skin and rashes on hand, particularly over the palms. Sometimes even blood oozes out while washing or sanitizing. What's happening with him?
थिक मॉइस्चराइजर्स, वैसलीन, पेट्रोलियम जेली, दिन में 10 बारी कहूंगी तो आप 5 बारी लगाओगे, लगाओ. दैट इज इंपॉर्टेंट. सैनिटाइजर्स अवॉइड करो. कट्स पे यू कैन यूज सम एंटीबायोटिक एंटीसेप्टिक क्रीम्स, एंड फिर भी नहीं हो देन यू विल नीड सम स्टेरॉइड बेस्ड क्रीम्स. तो मीट अ डॉक्टर.
Yeah, meeting a doctor is important because
if you are not settling.
Mr. Sujit Kumar Pandey, that is your question. Amit Verma is asking this question. What do you recommend for suntan?
Suntan, yeah. So basically use a good sunscreen. If someone is prone, कोई रहते हैं कि जरा से गए तो ज्यादा काले हो गए, then you need high SPF sunscreens 50 के आसपास. रेगुलरली यूज करना है. कई लोग लेते हैं हम सनस्क्रीन लगाते हैं, लेकिन जब सुबह मॉर्निंग वॉक 6 to 7 जाते हैं तब सनस्क्रीन नहीं लगती. तो यू आर गेटिंग द सन एट दैट टाइम. तो वो समझ, जहां भी आप घर से बाहर स्टेप आउट करें, सनस्क्रीन हैज टू बी अप्लाइड अनलेस इट इज डार्क. दैट इज वन कंसेप्ट. और जहां ऑलरेडी टैन हो चुका है, देन क्रीम्स आर अवेलेबल. जैसे मैंने कहा, ग्लाइकोलिक एसिड, हाइड्रोक्विनोन, कोजिक एसिड, जो हेल्प करेंगी रिड्यूस करने को. उससे भी वर्क नहीं कर रहा, देन यू नीड केमिकल पील्स.
Okay. Ma'am, Jafar is asking this question. I have fungal infection near thighs. I'm using luliconazole cream for 1 month and infection is spreading more. What is your suggestion?
हाँ, तो क्रीम के साथ इनको वो लगेगा, ओरल एंटी फंगल टैबलेट्स लगेंगे. बेटर मीट अ डॉक्टर बिकॉज आपका बॉडी वेट क्या है उसके अनुसार दिया जाएगा. एंड यू नीड एंटी फंगल टैबलेट स्ट्रेट फॉर अ मंथ. पूरा लेना है एंटी फंगल पाउडर्स. लुलिकोनाजोल इज अ गुड प्रोडक्ट. शुगर्स चेक करने हैं क्योंकि प्री डायबिटीज, डायबिटीज में फंगल इन्फेक्शन कॉमन है. एंड ऑल द क्लोथ्स नीड टू गो इन डेटॉल फॉर हाफ एन आवर, नहीं तो कपड़ों से बार बार री इन्फेक्शन होगी.
जी. Arpan Biswas is asking, he's 30-year-old, 70% of my hair has become gray. Now mustache and beard are also becoming gray. I'm very young for this. So what's the reason of early premature graying?
Mostly तो improper diet रहता है, with the vitamins are missing, especially vitamin, the B complex vitamins. एंड दूसरे में रहता है कि जेनेटिक रहता है, कई लोगों में फैमिलीज में होता है कि द ग्रेइंग स्टार्ट्स अर्ली, समटाइम्स यू सी फॉलोइंग इलनेसेस, से आपको टाइफॉइड हुआ, कुछ अदर मेजर इशू हुआ, then the graying starts. अगर 70% है, little unlikely, and he's 30 years, so unlikely that the medicines would work, but still you should work on his B complex, this thing, a multivitamin with a good B complex composition. And there are some lotions he can use, again available, we have to explain him. They may or may not work, क्योंकि जितना जल्दी शुरू किया जाए, they work better on premature graying. He has to learn the art of hair dyeing.
Okay. Mr. Ashok Kumar Jain is 58-year-old, and he uses for redness and itching of skin, he uses Moisture X cream, which gives some relief while being used. If I stop, there is redness and itching again. What can I do?
तो बेसिकली उनकी ड्राई स्किन है, मॉइस्चर एक्स इज अ गुड मॉइस्चराइजर, इसलिए जब तक यूज कर रहे हैं उनको फायदा है, जहां छोड़ते हैं वापस होता है, तो कंटिन्यू यूजिंग मॉइस्चर एक्स, नो प्रॉब्लम, लाइफ लॉन्ग यू कैन यूज. यू कैन गो टू एनी रेगुलर मॉइस्चराइजर ऑल्सो और कंटिन्यू दिस प्रोडक्ट इफ इट इज वर्किंग वेल. अगर आपको शुगर थायराइड्स कुछ है, देन प्लीज हैव इट चेक्ड, दैट्स इंपॉर्टेंट.
Yeah, Mr. Arif Mumtaz is in Delhi. Noida से है ये, and he has a problem. Whenever there is cold की start से he has itching all over the body.
Yes.
It's a
Cold.
dermatological.
या सॉरी, तो कोल्ड में यही होता है ना, स्किन स्टार्ट्स गोइंग ड्राई, और दिल्ली की ठंड तो नोन है, इट इज वेरी कोल्ड थिंग, इट विल गो वेरी ड्राई. सेकेंडली दे स्टार्ट यूजिंग द ब्लैंकेट्स एंड योर स्वेटर्स, ऑल वुलन मटेरियल, सो वुलन मटेरियल भी इनको ड्राइनेस और इरिटेशन दे सकता है, ड्राई स्किन को इरिटेट जल्दी करेगा और स्किन ड्राई होने लगती है, तो मॉइस्चराइजर ज्यादा करना है. देयर तो दे डू अ लॉट ऑफ ग्लिसरीन बेस्ड प्रोडक्ट्स ऑल्सो, नॉर्थ इंडिया में ग्लिसरीन का प्रोडक्ट्स इस्तेमाल करने से इट वर्क्स आउट बेटर. And he has to just change his skincare when the season changes.
Okay, done. Ma'am, two quick questions from two women. One is Sandhya. Sandhya is 23-year-old, suffering from vitiligo in lower lips and alopecia. I'm taking Tarcolimus, 1% for vitiligo. Can't see any improvement and also very heavy hair fall. How do you overcome this? This is one. Ma'am, I know that you understand a bit of Telugu. There is somebody who's continuously asking a tip for Mangu Machalu. I'm not sure what it is called in English. So you understand a bit of Telugu, so if you can also.
Mangu Machalu.
I'll also Google it, ma'am, in the meanwhile.
I don't know.
So if Mangu is vitiligo, that is also white patches, right?
White patch, even I
So that's the
assume
reason
that.
why I thought while you're answering vitiligo, she might find an answer.
Yeah. So basically what she's saying, vitiligo with hair fall, the two issues.
Hair fall, and she's using.
Yeah, tacrolimus, that I got.
Yes,
fine.
yes, ma'am.
So she may be having an underlying thyroid issue because both could be connected. And tacrolimus is a safe medicine, but sometimes it works very slowly. So topical steroid creams can be added. Narrow band UVB therapy can be added. Some sunlight based regimes can be added. And for the hair fall, of course, again, if thyroid is there, that has to be corrected. We have to look for nutrition and any dandruff. So it will be a multi-system approach. She needs to be tested. She has to get in touch with some local dermatologist.
Okay, ma'am. So, ma'am, I Googled what Mangu Machalu is. It is hyperpigmentation, all those black marks that they
Oh, melasma. Okay, got it.
Melasma,
Melasma, yeah. So that is again a hormonal issue. It could be related to, post deliveries. It could be related to thyroids, PCODs, and the job. She was a lady, I guess, no? You said?
Yes, she's a lady. Yes, ma'am.
So again, if she's working or not, going out in the sun, even our farmers and all who go out a lot in the sun, we are seeing.
Ma'am, she's 25-year-old, ma'am.
25. Okay, fine. So,
and Dhanlakshmi is her name.
Okay, done. So, okay, so again, it depends on the sun exposure, whether for school, colleging or her work, I don't know that. She must use a good sunscreen of SPF 30 to 50, depending hours that she's spending, even in commuting, because even in commuting, many people say, I have 1 hour commute, but I'm in the car. You're still getting the sun because the tints are out. So we are all getting the sun and the sun damage that will trigger it. If she has a hormonal issue like thyroids, PCODs, that has to be checked in. There could be a family history also. And then again, creams like hydroquinone and your glycolic acid, kojic acid, common agents which we use. And there are newer drugs also, so depending on what she has used, it can be used. Only one thing I'll say is that there is no permanent solution for this. It tends to go away, reduce most of the cases, but it can recur. So let's see that it doesn't spread further and remains minimum, with that you can cover up with the makeup.
Yes, then Lakshmi, You found your answer. I'm glad you asked this question because it was, vernacular language में कोई पूछते हैं तो it gets difficult to answer, but I'm glad she asked this. All right, next question is Mr. Sushil Sharma's question. He's a 32-year-old male, body weight is 95, BMI. Sushil ji, आपका question complete नहीं है, एक साथ नहीं है, I'll take it later. Ma'am, Sudeep Ray is asking, calloids है उनके back पे.
Okay.
Advice, I've already gone through steroid therapy. Further
So steroids, mainstay of this is steroid injections. There are some other drugs like 5-fluorouracil, उनके भी injections दिए जाते हैं. You can combine it with cryotherapy depending आपका center कहाँ है. They may be having cryotherapy combined with these injections. Certain gels, silicone gel sheets. Keloids are a little problem to treat. So depend करता है, you will have to go a little aggressive. Try to follow up regularly with your doctor and take the shots, cryo, जो भी available है आपके center में. और बहुत multiple हैं, then we can sometimes give low dose radiation also. अगर बहुत किसी की रहते हैं बहुत 50-100 आप कितनों को injection देंगे, तो then we advise radiation also.
Okay. Quickly, last two questions. Shubha Nair is asking about under eye dark circles. Can we remove them with omega-3 capsules? That is one. And Sai Shivani has PCOS in a very less PCOD, but periods are normal. Use many creams, but I have acne and also facial hair. Two different, but these are the questions.
Okay. So coming to under eye circles, basically we have to look if there's any anemias, there is any eye strain, if there is any error of number है, तो वो correct करवाना है. Late night sleeping habits, family history है dark circles का, all that has to be checked into. And then again we go down to the creams, basic skin care of, as I said, glycolic acid, kojic acid, those kind of preparations are used. Vitamin C creams are there which are safe around the eyes. And उससे भी नहीं हो रहा, then we go to chemical peels, under eye circles. And the other
cosmetic reasons.
Cosmetic reasons, absolutely.
Yeah.
And coming to your other question, PCOS, where she has hair fall and acne. Then
it's not hair fall, ma'am. She has acne, one pimple a day she gets. Her period is normal, has a slight PCOD. I've used many creams, but of no use.
Hirsutism. She had hair thickening.
Facial hair.
Facial hair she had, yes. Okay. So basically, see, the question again with PCOD is, big misnomer is that I have a mild PCOS and a bad PCOS. There's nothing like that. You have a PCOS or you don't have a PCOS. Okay, PCOS may give me symptoms. It may not give me symptoms. Right now, PCOS is giving her symptoms, 2 symptoms, 1 acne a day, that means a recurrent acne, and दूसरा है the thickening of the hair. So she needs treatment for PCOS, क्योंकि कई बार ये confusion अंदर से नहीं, गायनेक ने बोला है कि बहुत कम PCOS है, पर आपको प्रॉब्लम तो हो रही है ना, तो प्रॉब्लम हो रही है तो PCOS का ट्रीटमेंट लीजिए, वो समझना जरूरी है. तो बहुत वो रेजिस्टेंस रहती है क्योंकि कोई बोल देता है कि नहीं ट्रीटमेंट करने की जरूरत है, उनको जरूरत है स्किन की तरफ से, नहीं तो बाल उतने ही थिक होंगे, उतने ही एरिया का लेजर्स लगेगा, उतना ही सेशंस होंगे, उतनी ही कॉस्ट होगी. तो वर्क ऑन द PCOS राइट नाउ. Acne, of course, depends on what face wash you're using. So for oily skin, face wash kariye. Creams containing adapalene, tretinoin, clindamycin can be used. But main thing is, please treat your PCOS. Many girls are scared the minute they hear PCOS. There's nothing to worry. It's just a phase of it, hormonal imbalance. टाइम के साथ सेटल हो जाएगा, लेकिन उस टाइम में आपको बॉडी को हेल्प करना है. अभी कल ही एक पेशेंट है, ओल्ड पेशेंट, PCOS चल रहा था, हैड पुट हर ऑन सम ड्रग्स. वी गिव मेटफॉर्मिन करके एक ड्रग रहती है, and she's just in her 20s and she has turned to be diabetic. What do? PCOS has given her that. So you have to understand PCOS needs management. अभी वो PCOS खाली PCOS नहीं है, वो पूरा एक disease spectrum है, different departments में क्रॉस करता है. अगर है और आपको symptoms दे रहा है, ट्रीट करो. अब कई लोगों का accidentally पिकअप हो जाता है तो उसकी ट्रीटमेंट की जरूरत नहीं है, आपको symptoms नहीं दे रहा. And hers it is a thickening of hair growth है, definitely she needs lasers in the long run. There are some drugs which can be given, hormonal drugs, लेकिन अगर आप PCOD को ट्रीट नहीं कर रहे हैं, those tablets will not work. वो समझना जरूरी है, वो बहुत important है.
Yes. Ma'am, time to wrap up. Thank you so much for such patient answers. And before I wrap up, I would want you to sum up the best hair care and skincare lifestyle regimen tips that we can follow.
Okay, fine. So coming to skincare, I would suggest first, please understand your skin type. Understand कि जैसे आप grow old करेंगे, your skin type may change. dry as a young child, becomes oily as you grow in your teenage years, active years, and again goes dry as you grow older. Face skin may be oily, but body skin may be dry. So different areas को depending on the skin type treat करेंगे. Same product सारे body पे नहीं लग सकता. Most of the people we need different kind of products. Products जब choose करें तो देखें आपको suit होए. You can afford it in the long run and stick to one product. It is not necessary कि market में एक नया product आए तो it will be better than the one that you're using. Simple coconut oil is one of the best moisturizers I still personally use. So there is nothing like that. Secondly is if you have a sensitive skin, you should be very careful of what products you use and use minimum products so that आगे चल के if you have to try out, especially cosmetics, young girls को हम बोलते हैं, then you won't be able to use cosmetics. So don't keep changing your products and sensitize your skin. Go to minimum products. Then home remedies agar karni hai, so do one at a time, try, give it up a week, 10 days time, and then try it out. Do it in the evening hours. Don't do it and go out in the sun. And one thing is what product suits someone, your close friend or even your sister for that matter, may not suit you. So choose your products depending on how your skin responds. Other things like climate change, your stress levels, your food habits, your other diseases like diabetes, thyroid will definitely affect your skin. So you need to take care of all these things. Whenever you come to a skin doctor, please carry all your set of reports because many times people think it is not important. It is very important because skin is a reflection of the body. Okay, what you can see, you can't see inside, but you can see your skin. Coming to the hair care, I would say stick to regular shampoos or soaps, whatever you used to. I would always recommend a shampoo because soap tends to hold the hair and there's more breakages. And if you have oily scalp, then please use a good anti-dandruff shampoo, stick to it. There is no permanent cure for dandruff. So continue using the product till you have those issues. Let not the dandruff become a cause of hair fall. Again, the lifestyle changes in the form of your diet and stress makes a difference on hair fall and your dandruff things. If you have PCOD, also another thing, common cause with hair fall, please work on it. Don't get scared. Take medications for some time so that PCOD settles and eventually all your other issues. And you may not develop diabetes. We don't know. With research is still going on. We are also understanding the spectrum. So I think if you follow these kind of things, then you can do home remedies again for hair care. I have nothing against it, but see that it suits you.
Yes, ma'am. Thank you so much. With patience, you've answered all the questions. A lot of people have been repeating questions, urticaria and then dry skin and dandruff. We have answered these questions in the beginning of these. Yeah. If you want to catch the session later, you can watch it on YouTube again. But thank you so much, Dr. Radha.
Thank you. Thank you,
Jhansi. Thank you, ma'am. Bye.
Yeah.
So, ladies and gentlemen, quickly wrap up karenge before we go. Here is the health quiz. Get ready. I'm going to ask you 3 questions. You're going to type your answers in the chat box. Winner's name I'll announce towards the end of the show, and winners have to mail your contact details to us at marketing@apollo247.com. Gift vouchers will be shared to you. So get ready. Question number 1 for today is, which is the largest organ in the human body? Which is the largest organ in the human body? Answer pata hai to aap type kijiye. And question number 2 coming up. How many layers are there in human body? Human body में कितने layers है? How many layers are there in human body? Wow, answers तो बहुत सारे आ चुके हैं. Lavanya Kumari, Sai Lakshmi, Payal Gar, you all have answered. Skin, Santosh. A lot of people have answered. So question number 2 was, how many layers are there in human body? Okay, 3 is something that people have been answering. Last question coming up, question number 3. How many features are there in Apollo 24/7 app? How many features are there in Apollo 24/7 app? अगर आपने app अभी तक download नहीं किया है, Apollo 24/7 app download कीजिए. You will be able to figure out how many features are there. And that's the last question. I'm waiting for the winners. But before I take leave from you all today, I would want you to be reminded of battleground vaccine. We all know that we are expecting vaccine. Abhi to days ka waiting, months ka waiting has come to days of waiting. We are all waiting. 60 to 120 days bhi nahi. I think it will be a little lesser than that. But you want all the updates, and if you and your loved ones, especially the ones with slightly more हाई प्रायोरिटी इश्यूज है तो उनको आप रजिस्टर कर लीजिए बैटलग्राउंड वैक्सीन पे. There's a vaccine tracker. You can scan the code which is on the screen, or you can also visit the website and you can understand what is vaccine and get your loved ones on the list, so that as and when the vaccine is ready, Apollo is ready to administer 1 million vaccines per day. So make sure you're on the list, and we are all waiting for a happy and healthy society once again. So that's it, and let's see who the winners are for today. The winners are Lavanya Kumari, Kirti Vernam, and Reshma Mariam. Congratulations. Please write to us. All your details should be sent to us on Apollo marketing at apollo247.com, and your gift vouchers will be shared with you. Thank you so much, all of you. I thank all the participants. A lot of questions which are left unanswered. You can consult Dr. Radha Shah on Apollo 247. And I thank Dr. Radha for being here with us, all the participants who have been with us. Thank you so much. And here are the gift coupons on the screen. You can use this code Apollo247. You can get up to 299 rupees off on online consultation with Apollo doctors. You can use the coupon medicine10 to get 10% off on pharmacy orders. Log on to apollo247.com app, log on to the app to use the coupons. So I take leave from you all today. That was an interesting session. Take care of your skin. Thank you for joining, and please give us your feedback. You can share your feedback with us at marketing at apollo247.com. We keep making this show to empower you with more information and create a knowledge base and sharing the expertise with you. We'll come back soon with more of information. Bye-bye for now.